Well, we're really excited about this gift. This is a whole new chapter for us. After 40 years, our mission has enhanced to include clinical priorities in addition to medical equipment priorities for the Queen Elizabeth Hospital. And the Oscar Waugh Friends Foundation donation is one of our first, which we would consider a clinical priority. And it allows us to buy the Buzzy Bee. And it was so nice hearing the explanation of that a little piece that looks like it could be a bee or a ladybug that vibrates on the arm. And it's really a distraction for when a procedure needs to be done or a needle needs to be given. And those go home with the patient. And so again, when we provide medical equipment, that's not something that goes home with the patient. So that is a really nice piece that we've been able to do. And in addition to that, this allows us to create what we call travel kits for other oncology patients who need to travel off island, because much of the care is here. It starts here, have to go off island for specialty care in that area, but comes back here for their oncology follow-up and ongoing services. So we are delighted with this gift. It really is a transformation of what we've been doing for over 40 years now.
So the travel package has a gift card for the bridge. It also has a gas card for the family, and then a third gift card to a local Tim Hortons or Wendy's so that they can get some refreshments on their way for their drive. So all patients who attend IWK for oncology appointments, as many appointments as they need, if they're coming back to PEI and not there for their treatments, then coming back and forth, we give a travel package to each family each time. This is of major significance for them. It is a very stressful time. It is also a very financially taxing time. Often a parent or caregiver can't work and they need to be traveling and be with their child. So the program that Oscar Waugh, the Friends Foundation, gives to the families, they're not eligible for funding in other places. So it's instrumental in them being able to reduce their stress and get back and forth. And for myself as a clinician, it gives me an opportunity to talk to them, a really lovely gesture to be able to provide them with the support and also check in on how they're doing.
Sure. Like Buzzy Bees are a distraction tool that we use when we're starting IVs or doing painful procedures like a poke or an injection. We can freeze the wings and put them on to freeze the area first. We strap it to their arm above where we're going to do the painful procedure and turn it on as a vibration, and that vibration tricks your brain into focusing on the vibration and not the painful procedure that's underneath. So a painful medication going into the skin or an IV poke that dulls the poke and makes it a little bit more tolerable. So the kids that are getting frequent IVs or they're getting medicine daily and sometimes every couple of hours that really sting when they're going in, it's just a way to make it a little bit more tolerable, a little bit more humane. The kids love them. All of our oncology kids and our kids that are chronic and need a lot of painful pokes are able to get a Buzzy through the Oscar Waugh Friends Foundation, which is amazing, and it's very well received. They take them home and then they take them with them. So if they're going to go to the IWK for blood work, they'll take them with them. If they're coming to us for blood work, sometimes they forget we still have them and they'll, oh, I have my Buzzy in my pocket. No, we're going to use it. So we use it with pretty well everyone. We've even used it on 70-year-old ladies on the inpatient unit, and they say, did you come up with that? No, but we use it because it works really well.
And it's incredibly meaningful for us to know that this fund and the generosity of others has helped so many kids and will help so many kids into the future. The little impact of the Buzzy Bee and travel packs is so meaningful to us and so many others. So we're very, very grateful and thankful. I think he'd probably roll his eyes a bit. He was so unselfish and never was one for seeking the spotlight. But seriously, I think he would be very glad and thankful for all of the support that we've gotten from so many people. The Community Foundation, you and Emma, have been just fantastic to us, and we thank you so much for that. Staff here at the hospital have been just amazing all throughout the course and continue to be. So I think Oscar would be very, very, very proud and very thankful. Oscar had literally hundreds of injections over the course of his care. And each one of those comes with a little sting. And the Buzzy Bee was a game changer, literally. It just made a little distraction from the sting. And not only was it a help for Oscar, but it was help for Catherine, his mom, who was there for most of those injections. And so for her, knowing that his pain is a little bit less really helped her as well. So yeah, it's very meaningful. And just such a small little device that's helped so much. It's a journey, and some days are tough, and you know, coming here can trigger some memories maybe that we'd like to forget. And as I told you before, sometimes these events I dread, but I always leave feeling uplifted from the support, and I think my family feels the same way. So yeah, Oscar lives on through the foundation and the fund, and will live on after I'm gone, and all of us are gone. So it's incredibly meaningful.
Well, when a child is diagnosed with cancer on PEI, it usually means a lot of trips to the IWK for treatment. And Oscar knew that very well. We spent over a month there initially, weekly for a long time, and then minimum of every 3 weeks. So we would have these long drives over, and they would be for chemotherapy or radiation treatments. There'd be MRI scans and CT scans and PET scans, blood transfusions, surgeries, blood work. So many reasons to be over there. Oscar and I spent a lot of time in the car, and we know how much it means to be able to spend this time together and maybe create some happy memories along the way to these difficult times. And you want to be present for your child. You want to be there for them to help them through these scary times, these confusing times. You want to be supportive. And you don't want to have in the back of your mind, how am I going to put food on the table for my kids? How am I going to pay off my credit card from all these purchases of gas and tolls and bridge on the way over that happen sometimes weekly? So to be able to provide some financial support to these people so that worry is not in the back of their mind, that they're able to spend time with their boy or their girl, you know, because they're living with cancer and you want to be able to spend time with them. And like I said, not have these worries in the back of your mind. So the hope was Oscar knew how much these trips cost. He was old enough to understand. And he knew how that could be a distraction. And we were fortunate enough to be able to spend time together, to really make the most out of these trips, to get to know each other, to spend time, make some happy memories, and I could focus on him and getting him through these trips and be present for him. And that made all the difference to our family and to Oscar. And we just want the same for other families. So Oscar was 13 when he was diagnosed with cancer, but he was a big 13. He was 6 feet tall. And people never saw him as the little boy he was. He was a little boy. And so Holly here in pediatrics didn't see him as this old teenager who would just snuff his nose at, you know, trying this Buzzy Bee that looked like a child's toy. She actually went to him and said, would you like to try this? This is how it works and it might help. And Oscar said, sure. You know, anything, I'll try anything, it'll help, if it'll help. And it did. It made such a difference. And we were able to purchase one and take one home. And Oscar got so much use out of this Buzzy Bee at home with pain medications. It made all the difference in the world. And he also, we had home care nurses come into our house, and he would tell them what the Buzzy Bee was because they had not seen one before. And he explained how it worked and how much it helped him. And they were actually able to introduce it into palliative care as well. So people of all ages, children going through cancer, any age, can benefit from these Buzzy Bees. And in case you don't know how they work, you'd have a pain medication or otherwise go into a PICC line or a butterfly, and the buzzy bee would be placed between the injection site in your brain, and it would vibrate. And all it did was confuse the pain signal from the injection to your brain, and your brain wouldn't experience it as that large amount of pain. It would lessen the pain, maybe even remove the pain for some times, depended on the injection. So it worked so incredibly well for Oscar. And so we talked about it with Oscar. He knew that we were putting this foundation together before he passed. And it was very important to him that every child have one of these buzzy bees if they needed one at home, so they could live with less pain. Because they're living, and it really affects your, what's the word I'm looking for? Okay. It was very important to him that every child who needed one at home could have a buzzy bee so they could live with less pain. This is one of the first things that he wanted with his foundation. So I am so proud of Oscar for accepting these buzzy bees and trying them, and for spreading the word of them, and for wanting to share them so that others could benefit. And I'm so proud of his sister Grace and his brother Harry for helping him through this. They would hold the buzzy bee from time to time, and it made a difference in our family, and I know it's making a difference in other families. And I can honestly see Oscar right now smiling at us, and he would have this bashful little shake of his head and just be in awe of everything he was able to accomplish and everything we are helping him accomplish for his wish to help other children. And that makes me smile to know that we're making him happy and making his wish come true.